Holly Health is an intelligent health coaching platform supporting patients with sustainable health and habit changes for long-term mental and physical well-being. Holly Health offers holistic support areas covering sleep, nutrition, exercise and mental well-being, and we deliver this through an entirely digital service on both web and smartphone app, which is tailored to the user's needs based on their reported behavioural health as well as their long-term conditions. We built Holly Health because the UK population is facing a health crisis and has been for quite a while, and healthcare must respond with scalable support. So we know that there's nearly 10 million people on NHS wait lists, the majority of which are declining on the list as they wait. Up to 40% of GP appointments have a mental health component, and 1 in 5 adults are on antidepressants, but the support beyond prescriptions is really lacking. We know that 20% of adults feel very lonely and that they don't have someone that they can talk with, and loneliness can be very, very significant impact on someone's health and well-being and longevity. People are being turned away from specialist obesity services because the wait lists are already too long, and 40% of the population sleeps under 6 hours per night. So Holly Health essentially addresses this by offering compassionate yet highly accessible support. We deliver this through an entirely digital service on web and smartphone, and in a low-cost licence package that has the potential to save the NHS billions.
Future Medicine AI sat down with Holly Health to learn more about their health coaching platform that was recently awarded the Best mHealth application at the 2024 Health Tech Digital Awards, and is also backed by the NHS Health Accelerator. Holly Health's digital coach, Holly Bird, is an evidence-based product built by psychology experts and underpinned by the psychological concept of small, achievable actions. This guides the end user to reach their goals through incremental, consistent habits that lead to notable lifestyle changes over time.
A lot of the tailoring in the service is driven by the user's goal, alongside what we can see their biggest challenges are. The Holly Bird, which is our digital health coach persona, guides the user through our onboarding, which takes into consideration a user's age, their gender, their goals, their lifestyle, and also their conditions, which then helps us to identify the right habits for the individual themselves, whether that's walking more or less screen time. There's over 100 science-backed habits for a user to choose from. Holly Health isn't about drastic health overhauls. We know that drastic health overhauls, they don't work, or they don't work for a significant amount of time. And then essentially when people start, then they'll fall off quite quickly. And we see this yo-yoing effect in behaviour change. So Holly Health is about small habits that lead to the significant lifestyle changes over time. It's the 30 minutes improved sleep, the 20 minutes more walking, or that one extra portion of fruit, veg or fibre. And it's doing these things consistently that add up that we see has the biggest impact in the long term.
We took a dive into the Holly Health app to get under the hood of some of its core features. Upon opening the app, you can see the homepage, which displays messages from the Holly Bird, your daily habits, check-ins, chat flows, and discovery. The habits shown here are based on goals set by the user, so let's swipe one to complete it. There we go. In the check-in section, you can log your mood, energy levels, and stress. After filling these in, Holly will provide a personalised response, offering compassionate suggestions to support your progress. The check-in section also allows you to log additional factors that might impact your day. These are tracked over time to provide a holistic view of your progress. Below the check-ins are tailored chat flows where you can interactively explore topics. Finally, at the bottom you have discovery, which suggests new habits for you to learn about. Now we'll move over to the progress tab, where you can get an overview of your progress towards habits, as well as your check-ins and other aspects of your health. Next, Holly Chat is home to Holly Bird, your interactive digital coach. Here you can check your progress, update your health readings, or even access crisis helplines if needed. The experiment section is all about learning and practicing new tools to support yourself. For instance, you can see here there's a blood pressure tracking challenge. The discovery section is like your personal health library, full of articles, audio and video on topics like mental health, sleep and nutrition. You can bookmark your favourite content and return to it whenever you need it. One of the most prominent features is the chatbot interface, which allows users to converse with Holly Bird in an intuitive way.
We decided to build in the coaching in a conversational-like way because we wanted Holly to feel really relatable and provide a supportive coaching experience. Our users tell us that they love the Holly Bird chatbot feature and that although they know it's not human, it can feel as compassionate or human-like as human coaching. Conveniently, it's just there in their pocket, gently sort of supporting them throughout their day. Our current chatbot is built in a clearly defined and controllable way to be extremely safe.
Let's have a look at a quick demo of the coaching experience with Holly Bird. Here on the chat tab, you can start a new chat, select the progress and coaching option and goal review. Holly Bird will then check in on your progress towards goals you've set. In this example, the user's goal is maintaining weight sustainably. As you can see, Holly Bird takes us through a quick review of our progress, providing motivation and support along the way. Healthcare institutions are central to the delivery of Holly Health and ensuring a broad reach to users that need it most. We were keen to learn more about integration with hospitals and the value created by these important relationships.
Over 90% of Holly Health users are referred directly in from healthcare providers within primary and secondary care who pay for the service because we're helping to alleviate pressures on their staff through reducing GP appointments, and we're enabling them to essentially deliver holistic support on a large scale for the first time. To date, we've supported over 40,000 NHS patients through partnerships with over 200 GP practices, and now multiple hospital teams and private healthcare providers. The method for getting Holly Health out to lots of people is typically via primary care using batch SMS. So through a single text, we can send a link to On Board with Holly Health to a whole population in a couple of minutes. We can also integrate with systems like PKB or Patients Know Best and deliver Holly Health at convenient times like after a health check. So as Holly Health is delivered through an entirely digital service on web and smartphone, it's really low cost. So its low cost license package has the potential to save the NHS and healthcare organisations billions. We're all about getting that accessible support to as many people as we can, and we see an average return on investment of around 15 times depending on the population size.
With thousands of users registered to date, Holly Health has a large active user base. What has been the measurable impact for these users?
We hear from our users every day about how Holly Health has helped them to transform their lives. And what we hear most often is that the compassionate, be kind to yourself approach is what really keeps them motivated on their health and wellbeing journey and keeps them motivated to keep going. Our outcomes include significant average increases in exercise and mindfulness and significant decreases in anxiety and stress. In total, we measure over 20 markers and we see strong, consistent average improvements in all of them. Our average outcomes, for example, after using Holly Health include an average reduction of 8 GP appointments per year in frequent attenders, so those are people that go to the GP very regularly, an average exercise increase of 40 minutes and an average mental wellbeing increase of 31% measured by the ONS4, which is the standardised measure for health and wellbeing. An average energy increase of 19% and an average weight loss of 6% after 6 months, and then lastly, reductions in systolic blood pressure and HbA1c.
Given its impressive growth, Holly Health has begun exploring the integration of machine learning into some of their features. We were interested to know how this change is taking place and what it means for the future of Holly Health.
So we're actually in the middle of our Biomedical Catalyst grant project run by UKRI, otherwise known as UK Research and Innovation, that sees us explore the use of AI and machine learning to enhance our coaching. So through the use of ecological momentary assessments, otherwise known as EMA, which is a research method that involves collecting data about people's thoughts and their behaviours in their natural environment in real time, we're on our way to building our first innovation for hyper-personalised coaching. So using machine learning to develop a just-in-time adaptive intervention coaching, otherwise known as GTI coaching. So the goal with this is to deliver the right type of health and wellbeing coaching messages, saying the right thing at the right time when the user's most receptive and open to it. And we're working on this with Loughborough University, and we're actually in the middle of our first micro-randomised trial for this, so we're really looking forward to seeing the results as part of this project. We're really excited to see that the market and policy are finally moving towards prevention and acknowledging the importance of scalable behaviour change tools. Having worked at that exact solution and mission for years, we're confident that Holly Health will continue to be at the forefront of digital innovation for entire populations. So our goal is to support millions of individuals with hyper-personalised and accessible coaching for better physical and mental health outcomes in many years to come.
If you're interested in learning more, you can contact them at hello@hollyhealth.io and visit their website for more at hollyhealth.io.